I think a medical student is drawn to pediatrics because we're not taking care of just the patient, we're taking care of the family as part of that.
Getting to take care of children and their families is an honor. The type of resident we're looking for at Vanderbilt is one who, first and foremost, is passionate about taking care of kids. That's why we're here.
We pride ourselves in our ability to train residents to be highly accomplished no matter whether their future is in general pediatrics, in subspecialty care, in advocacy, in public health service, or as the physician scientists of the future.
There's lots of nuances to becoming a pediatrician that aren't just hands-on patient care, but we start with the hands-on patient care as interns and kind of build on that through the 3 years that you're here. You're going to see all of the different types of patients, the different types of pathology here, but you're going to be surrounded by a very nurturing family. Vanderbilt supports you but challenges you on a daily basis.
One of my favorite things about Vanderbilt as a trainee and now as a faculty member is the mentorship that you receive here.
The supportive community here with my attendings, with the program director and the program staff, and then also my peers has just been amazing.
Your program director is going to be someone who's going to be in your corner.
Being a resident here is the best. It's busy, but it's tons of learning, and I wouldn't choose to be anywhere else.
Everyone I've talked to has just been incredibly willing to help you along your way to becoming the doctor that you want to be.
The attendings are so supportive, they know your name, they know what you're interested in.
We're all good at different things, and I think we all bring very different things to the table. And I think one of the best things about Vanderbilt in particular is that they are able to bring out the best in us.
I was drawn to Vanderbilt from the moment I set foot in the hospital for my interview. I think our exposure and the opportunities here are absolutely endless.
I had the opportunity to work with world-renowned infectious disease specialists and vaccine researchers.
All of us as residents have a continuity clinic that we participate in about once a week, where we have our own panel of patients that we see regularly so we can build those longitudinal relationships. My family is Colombian, and so being part of a Spanish-speaking community and serving the Spanish-speaking community has always been very important to me. Being a member of the Spanish-speaking clinic just means that all of my patients are Spanish-speaking exclusively. And I really got to build a rapport with my patients that they may not be able to build with a physician who doesn't have that same cultural experience that they do.
I'm in the education academic community, or EAC, and so what that means for me is I'm a part of a group of attendings, fellows, and residents who are passionate about medical education, anywhere from medical student education all the way up to resident and fellow education.
I was specifically interested in global health. Halfway through my second year of residency, I was able to spend a month in South Africa, and so we got to spend time in the intensive care units there, observing what it's like to practice what we think of as a very resource-heavy specialty in a resource-limited place. Some of the skills that I learned there were things that I've been able to bring back with me and how I practice medicine here.
I'm one of the co-chairs of the Wellness Committee. Wellness is a really big piece of what we do here. Social wellness is, of course, a component, so we've planned a lot of events. Being well both at work and outside of work is what helps us to be able to do the best job taking care of the kids that we do every single day, and that's the reason why all of us are here.
I think when you're looking for a residency program, it's important to seek out a program where you feel like your program will really go to bat for you and consider what it is that you want to do with your career, but also simultaneously think about the fact that you're going to be living in this place for 3 years and who you're going to be spending your time with.
I had never been to Nashville before coming for the interview, so the only experience I had was watching a couple episodes of Nashville, the TV show, which is very different than what Nashville actually is.
Nashville itself is really wonderful. I just encounter people from all walks of life. So many nationalities and ethnicities are represented just walking down the street in Nashville.
People want to come to Nashville, and I see why. It's a great place to live. I moved here with my family. My family is, I have a dog, a wife, and a child, not in that order, just to clarify. Although there are a lot of single residents and co-interns and things, there are also those with families, and so I didn't feel out of place being married and having a child when I came here, it wasn't like I wasn't the only one.
My experience here has been wonderful. I think it has completely superseded all of my expectations.
Just a good quality program where you get a lot of volume, you get to be able to see a lot of things that we call horses and zebras. You get a lot of both. And so it's being able to get the breadth and depth of training here that really stood out to me.
It provides you the clinical opportunities and the curriculum and things that may look very similar at other residency programs, but also provides you with an attending who's going to ask you, well, why are you making that choice? And want you to explain what your thought process is. And that is how you continue to learn.
The culture that we have here really is quite unique. I think when you're going to work very hard for a period of 3 years, it's also really important to be enjoying yourselves, to be part of a close-knit team that support each other, and to work in a collegial environment where everybody helps each other. We work as teams, we support each other in good times and in difficult times.
The thing that I love about seeing the residents here at the hospital is just the joy they have of being around each other.
The residents here are not just my colleagues, but they're my friends outside of work. These are friends that I will have for a lifetime. And it's been a privilege to get to train alongside them and learn with them.
You learn so much in residency in 3 years. You can't imagine how much your knowledge base grows, but just how much you grow as a person and how much you learn about interacting with other people. It's a humbling journey, but a very important one and a very rewarding one.